to commemorate the World Breastfeeding Week and also the National Breastfeeding Month for 2023. So we are very happy to have the national level advocacy workshop with all the partners who are involved in breastfeeding with us today. So first of all, I would like to extend my warmest welcome to our Director General of Health Services, Dr. Asila Gunawardana. In spite of his very busy schedule, he was able to attend our workshop today. Thank you very much, sir, for your guidance and also for your direction and also participating at this very important workshop today. And also I must extend my warm welcome to Dr. Susie Pereira, our Deputy Director General Public Health Services, who is always guiding us and being our immediate supervisor, supporting all the activities related to the family health program at the Family Health Bureau. Thank you very much for your guidance and also for your presence today. I extend my warmest welcome to Dr. Nigel Rawlings. He is the WHO consultant from Geneva. He is a pediatrician by profession and also member of the research and guideline development team in the Department of Maternal, Newborn, Child and Adolescent Health and Aging in Geneva, Switzerland. So thank you very much for your guidance. I think during the last 3 days, we had a lot of educational sessions from you. Thank you very much for agreeing to be with the Sri Lankan team and also having this advocacy workshop with your guidance to educate our community. So thank you very much for your presence and warmly welcome you to this important event today. And also I must welcome almost all the directors of the Ministry of Health, including the Director Nutrition, Director Estate and Urban Health, and also all the other directors of the Ministry of Health, and also the hospital directors and the provincial and the regional directors of health services who are here with us today. The UNICEF and the WHO, our development partners, are very much useful and very helpful for us to promote breastfeeding. So I warmly welcome Dr. Abnu Daniel, Health and Nutrition Officer from UNICEF, and Dr. Damita Royal from UNICEF, and also Dr. Manjula Surya from World Health Organization. Warm welcome to all three of you for being with us and supporting the breastfeeding activities. And also I welcome the President of the Sri Lanka College of Pediatricians, Dr. Kosala. He has been a pioneer in promoting breastfeeding and all the members of the Sri Lanka College of Pediatricians and also the neonatologists who are here today because you are the leaders to promote breastfeeding at the institutional level. So warm welcome is extended to all of you. So I welcome all the other professional organization members, SLMA, Perinatal Society, Sri Lanka College of Obstetricians and Gynecologists, Medical Association of Nutrition Medical Association, and all the other relevant professional organizations who are present today. And also the members of the Sun Forum and other NGOs Sarvodaya who are here being partners of the breastfeeding promotion. And also the National Commissioner of Labour and the Assistant Deputy Commissioner of Labour for being with us and supporting us in legal measures and also the maternity benefits for mothers. I would like to extend my warm welcome to all the consultant committee physicians who are representing the provinces and the district, and also the CCPs from all our national organizations who are here because you are the leaders to promote breastfeeding, and warm welcome is extended to all of you. And also the medical officer of maternal and child health who are at the district level pioneering breastfeeding and MCH activities at the district level. So I extend warm welcome to all of you. Let me also take this opportunity to welcome all the media personnel who are representing print and electronic media, because your support is very much needed for us to give the messages to the general public. So thank you very much for your participation, and welcome all of you for this event. And also the Ministry of Health is another important unit, is the legal unit of the Ministry of Health. Ms. Riaz Ahmad, the legal officer of the Ministry of Health, and her team. So I extend my warm welcome to all of you. I hope I don't know whether I missed anyone, and the hospital directors, the consultants, and I think all of you are really greatly welcome to this event, because this is an advocacy workshop. So we need to advocate all our stakeholders how to move forward to strengthen breastfeeding. Let me now take back at the achievements on breastfeeding in Sri Lanka, and also the theme of the National Breastfeeding Month. This time the theme is making a difference for working parents by enabling breastfeeding. So වැඩට යන දෙමාපියන්ට සහනදායී වෙනසක් මව්කිරි දෙන්න සවිය. So this is the theme of this breastfeeding month, and we are mainly targeting for the working mothers. That is today's need. So these are our national recommendations on breastfeeding in Sri Lanka. Initiation of breastfeeding within 1 hour of birth, exclusive breastfeeding till completion of 6 months, continued breastfeeding with appropriate complementary feeding for 2 years and beyond, no bottle feeding, no teats, and no pacifiers. So aim is to give all children the best start in life. So during this month, we wanted to create awareness, inform people about the working parents' perspective, and also regarding parenting, to safeguard the existing benefits and to advocate optimal paid leave and at workplace, and also the workplace support as important tools to enable breastfeeding. Because we know that at the workplace, the support given for breastfeeding mothers is not up to the standard. To engage with all relevant stakeholders to enhance collaboration and support, and also to take actions to improve the working conditions that are to support the breastfeeding activities. So Sri Lanka is very good, having many policy directives to support breastfeeding, national nutrition policy, maternal and child health policy, and also the Sri Lanka Code for Protection, Promotion and Support for Breastfeeding, and also the Food Act, all supportive of breastfeeding, and the breastfeeding strengthening in the hospitals through BFHI, practicing 10 steps of successful breastfeeding. So most of our specialized hospitals are abided by this. Establishment of lactation management centers in specialized care institutions, and also the conducting capacity building for our hospital staff as well as for the field staff. We adopt that 40-hour lactation management course, which is conducted for 5 days, and IYCF training for 5.5 days, and also the growth monitoring and promotion training for 4 days. And we are now digitalizing this training using e-modules, and also establishing breastfeeding rooms or daycare facilities in healthcare institutions and also in estates. Breastfeeding indicators, we have achieved a very good high level indicators. Early initiation of breastfeeding as per last DHS 90%, exclusive breastfeeding for 6 months 82%, continued breastfeeding at 1 year 95%, and continued breastfeeding for 2 years is 87%. And also in the assessment of WTI, Sri Lanka ranked first out of 97 surveyed countries supporting breastfeeding at policy level. So this is a very high achievement in 2019. We were little bit of, I think the affected areas were bottle feeding and also the support for legal measures. And also we have seen, though we have achieved high rates of breastfeeding and exclusive breastfeeding rate, there is a decline pointed at the 4th month in infancy. So this may be because our mothers are going to work, and also there we don't have adequate support for working parents, and also the market challenges to discourage breastfeeding at this age. So we need to support working mothers. We need to address the marketing challenges. So this advocacy workshop is aiming at to advocate for the responsibility of the government, national, provincial and district level policymakers, all health stakeholders and non-health stakeholders, and also the workplaces and the community. So there are many activities that were implemented right throughout the country to improve the breastfeeding rates among the working mothers. So that's why we want to have the mass media publicity. We have to involve the media to support for advertising campaigns to promote breastfeeding and also appropriate complementary feeding. And also the Ministry of Labour to support the labour laws and maternity benefits to protect and support the breastfeeding recommendations among the workers in all work settings. We need to work with trade, Ministry of Trade, regarding the policies, taxes, and also the consumer affairs, right? So related to milk products and infant food products, and also other stakeholders like plantation, education, agriculture, economic development, indigenous medicine, livestock, and technology and research. So the multi-sector response and collaboration is essential to move forward and also to address the current issues in breastfeeding, especially targeting for working parents. So we had a highest level of advocacy. I think with Dr. Nigel, we were able to meet Honorable Minister, the Secretary Health, last Friday, and also Director General of Health Services. So anyway, we advocated him about our challenges, and hopefully there will be a good support from the highest political leadership from the Ministry of Health for us to move forward. So breastfeeding is a human right, a right of the child. So we should never deprive the child's rights of this miracle food. Thank you very much for your listening.